Recognize this man? How about this woman? They both suffer from the same rare psychological disorder, dissociative identity disorder. Dissociative identity disorder, formerly known as multiple personality disorder, is a psychological disorder characterized by two or more distinct personalities that share control over the body. Each personality is known as an alter and has its own name and gender. In this speech, I will inform you on the history of dissociative identity disorder, what the disorder really is, and how psychologists and/or psychiatrists attempt to treat those with dissociative identity disorder. Although dissociative identity disorder is a rare disorder, it is not a new disorder. The first case of dissociative identity disorder was described in 1646 by a man named Paracelsus. However, dissociative identity disorder did not become an official disorder until it was published in the Diagnostic and Statistical Manual of Mental Disorders in 1980 as multiple personality disorder. Its name was changed to dissociative identity disorder in 1994 in a later version of the Diagnostic and Statistical Manual of Mental Disorders. Perhaps the most famous case of dissociative identity disorder is a woman by the name of Shirley Ardell Mason. Shirley Ardell Mason was diagnosed with dissociative identity disorder in 1954. Her story became so popular that it was turned into a book and later made into 2 movies. Shirley Ardell Mason is better known as Sybil. As I stated earlier, dissociative identity disorder is the presence of 2 or more distinct personalities. These personalities or alters frequently take over and control the body as if there is more than one person inside the body. One thing I want to make clear about dissociative identity disorder is that there is not more than one person inside of the host's body. Although it may seem that way, in actuality, it is as if the person with dissociative identity disorder has been broken and their personality is in pieces. Some symptoms of dissociative identity disorder are auditory and visual hallucinations, anxiety, panic attacks, phobias, transition in personality, and amnesia. Often people with dissociative identity disorder have other accompanying disorders. These disorders can include depression, post-traumatic stress disorder, bipolar disorder, and borderline personality disorder. Some statistics on dissociative identity disorder are: less than 1% of people suffer from dissociative identity disorder. There are more cases of dissociative identity disorder in women than in men, and dissociative identity disorder is often confused and sometimes misdiagnosed with schizophrenia and borderline personality disorder. There is no cure for DID. However, there's many treatment plans that can help make it better. Therapy is used often. Different types of therapy such as psychotherapy, hypnotherapy, and creative therapy can help the person with dissociative identity disorder become one. Medication is also typically used in patients with dissociative identity disorder, not to cure dissociative identity disorder, but to cure the other accompanying disorders that come with it. Therapy in conjunction with medication can make life better for people with dissociative identity disorder. However, it can take many, many years before they become cured. In conclusion, dissociative identity disorder is a rare but fascinating disorder. I hope I was able to clear up any misconceptions about dissociative identity disorder or teach you about dissociative identity disorder if you had never heard of it. I want to leave you with this quote by Soren Kierkegaard. Personality is only ripe when a man has made the truth his own. Thank you.